Hello and welcome to Perfect Flow. I'm your host, Beveridge, and before we get into today's episode, I just wanted to talk a little bit about this concept of perfect flow, this project, why I'm doing it, and what you can expect out of me over the next year. So I've been working for 5 years now as an engineer doing medical devices, and I'm up for a change. So I'm spending the next year delving into endurance performance, health and well-being, and delving into my own mind and my own body as much as I can, and sharing as much of it as I can also. I'm doing a podcast in addition to my normal writing. I think I prefer talking, definitely faster at talking. It's a lot easier to knock out a substantial amount of content in a conversation format, I believe. At least it works for me. This is all new territory for me, and as a result, it's making me pretty nervous, but I like that. I think it's good to be on the kind of not too stressful, but some degree of stress. I think it brings the best out of me. Just more on the project as a whole. I guess it's been pretty obvious to me that there's a lot of other people who are quite interested in getting into running, especially off-road, adventure racing, multi-sport, and the information out there is sometimes hard to find, sometimes not, but there's definitely a lot of room for people to get in and share this information a lot more fluidly. So I think that's where I kind of fit in, but at the same time, this is a selfish endeavor. This is a challenge for me. I'm trying to get the most out of myself, and part of that is just overcoming challenges, like doing things that you're scared of. So here I am talking to I don't know how many people, but we'll see where it goes. So the intentions with the podcast, I think, is to expand to a wide audience and be able to get information out faster. The setup at the moment is pretty simple. This is entry-level podcasting, 2 mics with little stands, some studio headphones, currently running just on software on my computer. I think as we go, we'll upgrade and get some cool live streaming, maybe get a video camera in here, live stream to YouTube, who knows? The sky's the limit, really, but this is really base level at the moment. If you like what you hear, then please follow. You can find me at genebeveridge.nz. That's GeneBeveridge.nz. And I also have perfectflow.nz, which I have my training tilt coaching platform, coaching website rather running off at the moment. So there's a different side to the project over there. If you have feedback, then hit me up. Easily find me on Facebook or through my website. There's a lot of room to grow here, both as myself and as part of the community, which of course includes the listeners. So there's a lot more to think about for me about how to improve this. It's certainly going to be rough and ready for the meantime, and I think I like that. I think it reminds everyone that you don't have to be super polished to get a good word out, and yeah, it just makes everything faster. No one has time for editing and cutting. It's just upload, record, upload, and go. So a little bit on today's guest. I've been working with Luke for about 5 years. He became my massage therapist after I searched long and wide in Auckland for someone who I felt had the insight to not just see where I was hurting, but figure out the root causes. So, I mean, I sought him out. He's not here, although I do have a relationship with Sports Lab, who he works for. The conversation's really not about that. I think we're at a different level where we're friends and we have a lot of interesting conversation all the time, and this is just one of them. It goes for about an hour and a quarter, and we talk about a lot of interesting things. We start with pain. We talk about what is it and why we feel it, how this relates to stress. Modern science is teasing out the relationships between chronic stress and pain and how stress presents from different sources. How do you think about the human body as a system? All these things intertwined, and we often compartmentalize them in our mind and forget how interconnected all these parts of the body and even our mind and emotions are. So he has some interesting insight on that kind of stuff. I guess as a massage therapist, you're quite holistic. You're dealing with very different problems with every person who walks through the door, and I think his approach is very pragmatic. We talk about fascia, where it is around the muscles, the skin, and even between the organs, which I found really interesting. And we talk a bit about needling and acupuncture, kind of just cover that there are some differences between Eastern and Western styles here, and there's just so many more things we could go into. There was many rabbit holes that we skimmed over that we'd love to catch up on, either with Luke or another guest in the future. And Luke will be on the podcast again. He's off to Kenya pretty soon. For 3 or 4 months, he's going to be over there with 2 of New Zealand's top runners as their massage therapist, and some insight into the crazy world of speedy Kenyan runners. That'll be really interesting to hear from him when he's back. So that's all for now. Thanks for being with me, and I bring you Luke McCallum. Yeah, so running on Tuesday, just warming into it, and then suddenly I've got this really strong pain in my left leg. I'm not exactly sure where it came from, and then a pain higher up into my pelvis, and it just kind of went away again. I just warmed up, and it was very painful. I had to stop and was trying to find this guy. I'm pushing all around the site of the pain, and there's just nothing interesting, and ended up finding something interesting further up the line. I'm sure most runners are pretty familiar with all kinds of black magic of the body going on. What on earth happens? It's not just muscles, not just tendons. There's more going on in the body.
Oh, what a question. I think when you look at pain or tightness or any sensation or feedback that you get into the body, you have to look at it from a global perspective rather than a very localized issue.
Yeah.
And if you look at it, I think if you look at it locally, that's where you miss out the bigger picture.
Yeah.
With a situation like that, and when you're running, you're putting a number of different stresses on the body, and so it's important to take things like that into account as well. Yeah, and then you would bring on different issues like biomechanics. You can look at fascial health, you can look at nutrition, you can look at psychology. All those different things can actually impact the sensations and the different feedback.
Yeah, because I think the only piece of information I have at that time is pain, and how closely does pain actually align to a physiological problem. Or maybe it just says that there is a problem, but it's not very good at saying where the problem is.
I think with pain and the use of pain, it's such a strong sensation we get, and there is such fear when you're a runner with pain.
With fear. Oh yeah.
Because quite often when we feel pain, our automatic reaction is, I need to stop.
Yeah.
Which is kind of the biggest red flag that you can ever tell a runner.
Yeah.
When you're told that you have to stop, your whole world comes crashing down around you, and so you kind of catastrophize the sensation of pain.
Yeah.
I think when you look at pain as well, it's important to take into consideration the global element of it. Because pain is something that is experienced different by everybody and experienced very differently at different times in people's lives. So, put in this way, I was to punch you, if someone was to punch me, the way that we both feel it is different.
Yeah, and there was some, like a few friends who are GPs now are just scratching the surface of this new paradigm where they're reducing people's general stress and seeing chronic pain disappear. And maybe 20 years ago, that would have seemed very mysterious. And there's a few insights that I've seen of people teasing into how the nervous system is working and how it's creating these sensations of pain. And they're as real as anything you'd normally feel, but the fact that they disappear when some sort of chronic stressor is removed says that there's more layers to it.
Yeah, I think when you look at the nervous system's response to pain or chronic pain or anything like that, and I think that exercise does come into this, and at some point is, so you've got your sympathetic nervous system, which is basically, if you were to go back to when we're Neanderthals, it's basically the fight, flight, or freeze response, which is you're running away from a lion in order to survive. That response is your whole nervous system is firing. It all goes is kind of all or nothing, kind of kill or be killed type of situation.
Mm-hmm. And not something we've evolved to endure constantly throughout the day.
Yeah, it's something that should be used when needed, not 10, 12 hours out of the day. And when you're looking at, if you look at a modern lifestyle of having all these things around you, these chronic stresses, which stresses would be determined of anything that puts more load onto the body. Exercise is one of them. You think work, financials, mental, emotional stresses, it all compiles into a big sympathetic nervous system load. And the challenge is, if you're always there, when are you going to recover?
That'd be so interesting to know, when you're doing your work as a massage therapist, how much of the work you're doing physically on the body is unwinding other stresses other than what these athletes or people have put themselves through. I don't know how you'd ever tease out that proportion, but to a degree, there must be some of the stress that you're helping the body to release is not produced from the sport itself.
100%.
Oh no, what are we doing?
I think that you'd probably have noticed this when you come see me versus seeing different people, is I quite often, even as a sports massage therapist, we get this connotation that more is more. You need to cause pain in order to heal pain. But
it feels satisfying. Like you kind of want to, the rest of your training, you're working to produce a longer term benefit. Yeah. And with pretty much every session, the harder it is, it seems to produce a better training response. And you take that mentality straight into the massage theatre. I can always see, like, I know that was the expectation for the first few times I went into massage, and that was mainly because that's what I needed at the time, but it's not always the solution I've found.
Well, it's exactly that. When you look at probably the saying, no pain, no gain, is probably the famous one that everyone kind of associates with training and recovery. But I think it's a bit of a changing time when everyone looks at how much load they're putting onto their body and they're thinking, well, that's a training philosophy. But it doesn't work all the time. Yep. And so that's where you've got this less is more approach and looking at trying to calm the nervous system down, because I'd love to say that I can fix people, but actually you just give them tools and help facilitate someone's body to heal itself. And then when I'm at work, a lot of the times then I'm looking at trying to give people the tools. So if it's something that is kind of psychosocially driven, or if they're really stressed out with work and they're not enjoying all these different things that are going on in their lives, why am I going to keep trying to chase this pain that's actually just stress built up in the body?
Yeah.
And the way for that to go away is actually just them to have this person that they can tell all their issues and problems to, and know it's not going to leave
Counselor.
it's exactly kind of that. I'm kind of like the soundboard that people kind of bring all these issues. I'm not a counsellor, I'm not trained as a counsellor, but it's kind of one of those things that happens when you talk to people about what's going on. It's pretty simple in the way of you just keep asking open-ended questions, and people are pretty happy to tell you whatever they have going on. And it's quite often those are the things that hold people back from getting better or performing it the way that they need to.
Yeah, that's really interesting. I'm taking it back to acute stress.
Yeah.
So that particular instance earlier this week, which was hasn't been repeated, it was just a one-off. Obviously the nervous system is telling me something. What are all the different physical things that can be causing that? So moving away from just like general stress, but what are the physical things that can be leading to such a strong pain?
I mean, I think if you look at something that is more acute, even if it is this thing that happens one-off, it's happened for a reason.
Yeah.
And your body's got to a point where it feels like it needs to tell you something.
Yeah, so it's probably not all the time, but it's probably not just something I did that morning. It's probably, or maybe something I did earlier that morning in the context of what I'd been doing in the previous month or in the previous year.
Yeah. And it can be as simple as something as like your body's just be like, hey, here's a reminder you are pushing yourself.
Yeah.
And also, I mean, for you at this point in your training cycle, you've got a race this weekend.
Yeah.
And there's the whole thing of like a taper tantrum, which is which is there's research into it. I'm not exactly sure what it is, but it's kind of looking at the different sensations that people get when they taper, and pretty much everything and anything that could go wrong will go wrong.
Yeah.
But that's more your brain overthinking, trying to check in with your body to make sure it's okay.
There's certainly a lot more awareness of your body.
Yeah.
And you'd see things that you just not normally looking at.
Well, that's kind of the taper tantrum. That's kind of, it's there, but it's not. Whenever I have
looking harder.
Yeah, I mean, I work with people all the time leading up to races, and they come to me with this injury that's popped up out of nowhere that has had no correlation to anything they've ever felt before, and they have a race in 2 days. I'm like, this isn't a real injury. The best thing you can do is just reassure someone that by the time that they wake up on race morning, they're actually going to feel pretty good.
Yeah. Just being more relaxed can help.
Yeah, I think especially if people are training for their first race, or they're coming back from a long injury layoff, and you're not really sure how it's going to go. It's kind of, I think it's a natural process to really try check in and be like, am I going to be able to push myself as much as I'd like to? Am I going to be able to make the distance if it's a longer race, like a marathon or an ultra marathon? A lot of people find that, that pain or sensation that they're feeling, it can either be this random thing that they've never felt before, or it's this old injury that they had 2 years ago that stopped them from being able to do their last event that they were training for.
That's a funny pattern to notice.
Yeah. And I think those types of sensations and feedback should be called sensations and feedback rather than pain.
Yeah, and draw an even bigger line between pain and injury.
Yeah.
Or would you? Yeah, or was that
I think so.
extending the line of thought too far?
I think if it's going to hang around for a long period of time, if it's an acute thing, say like a sprained ankle, and it's a very obvious
okay.
start, stop, injure myself, feel pain suddenly, versus I went for a run and I felt the sensation, and then I kind of tried to find something, couldn't really find anything. You're kind of really searching for something that's like it's not obvious.
So like 3 strikes and it's an injury. 3 runs.
But again, it's like trying to find something when it might not necessarily be there.
Yep. And also I've noticed once you've warmed up, sensations of pain tend to go away. I'm not sure exactly what's going on there, but that's another thing to take into account when you're trying to assess whether there's an actual problem or not. It just makes it even harder to determine in the session whether there's even something notable or not. I know there's times when it's sore, you warm up, it's gone, then you push hard, and then you're quite sore later that night. So that's kind of a counterpoint to the example that if it's just sore once, it's a problem. It's hard to know exactly what kind of problems are going to flare up. Or is it if you can associate it to something obvious anatomically? It's like if it's your Achilles that's sore, clearly your Achilles during warm-up, is that more...
I kind of think with something like that is when you have an injury that you can kind of work through, like I say an Achilles injury that kind of warms into it, but it might flare up afterwards, it kind of tells you a lot about the nature of the injury. If it's continuously getting worse and worse and worse, it tells you that you should stop.
So there's definitely more details here to absorb than just is injury yes or no.
Yeah.
Like, is it getting worse? How severe is it? Does it change as you get warm?
Can you mentally change it?
Can you mentally change it? Just will the injury away? I wish I could do that all the time.
I mean, I definitely think that there's, like, that's a case to be made. Like, whether or not...
I know I can do the opposite. I can almost focus the injury into existence just by thinking about it more. The more I pay attention to the injury, and then I guess I'm expanding the definition of injury a bit to all of the stress that is associated with it. But as soon as I start paying attention to something, then it's just a bigger deal. It gets totally blown out of proportion.
Well, that's when you have something called neuroplasticity.
Yeah.
And that's kind of when you're looking at if you think plastic, it molds into the shape that you want it to be.
Yeah.
And so you can make this great big expansive thing, or you can make conscious choices to diminish it as well.
How do people even research that in the context of injuries? Or is it just really anecdotal at this stage? Because I've got pretty strong anecdotes that at least if I pay a lot of attention, and also attention with my hands as well, like working into an injury often, I have this heightened sense of what's going on exactly in that spot. And I can see really clearly that between different sides in the back of my knee, those hamstring tendons, I've had problems more on one side than the other. And I can feel everything that's going on in there now because I'm focusing a lot on one side. And it's nice that I've got a comparison between the two sides. I can feel the tendons moving. And I've just spent years looking, thinking about and feeling, and I've got this really clear mental model of what's going on in there. And not on the other side. I can't feel anything on the other side. There's a blob of tissue.
Well, I think that's when you are gathering information to look at see how your body's feeling. If you pick up these different textures that you would consider worse on one side than the other, you're always going to feel or catastrophize the one that seems worse.
Yeah.
And I think most people can say quite confidently that they're always going to look at the negative side of things rather than the positive side of things.
Yeah, huge human bias there.
And that goes a lot further than just injury.
Yeah.
Like you look at the news and everything's negative.
Yeah, that's well studied as well.
Because the more negative it is, that is the response it gets people to hone in on it.
Absolutely.
And that's
can't look away.
But that's kind of tells you exactly what to do in the first place.
Mm-hmm.
Is you look at the positives and what's positive,
what's working.
Because you could be like, Well, my whole right side feels absolute rubbish. I'm not going to be able to run through it. You spin that on its head, my left side has never felt better.
Mm-hmm.
That's already turned a negative into a positive.
Yeah, and at least the emotional
component of it.
quickly,
And the more often you can do that, the stronger that neural connection with a positive train of thought about how your body's feeling, rather than this constant negative, everything feels crap.
Yeah. Yeah, and I can definitely relate to that. In the past, there's times where you're just overly determined and overly motivated to train, and this one setback, like a twinge mid-session where you have to cut the intervals short, it's just the end of the world.
Yeah.
And it doesn't have to be. It doesn't have to be that way. I'm a lot better now, and grateful every time I can finish the session. But you can see if you're running to be happy, which you probably should be at some stage along the line, then you need to cut that short. It's a really important thing to, I think, teach people from early on in whatever sport they're doing.
I think it's teaching people to learn what different sensations the bodies can tell them.
Mm-hmm.
Because even if you can differentiate the difference between pain and tightness, which present the pretty similar in yourself, someone else can tell you the difference.
Yeah.
But it's hard to be able to see the difference.
Yeah, right. When you look inside yourself.
Yeah, like I'm a runner myself, and I do quite a lot of training, but I also work in the medical field.
Mm-hmm.
I catch myself out sometimes. It's a really hard thing, especially if you're not in a good
I can
mental
see how
frame of mind yourself.
Like the way you look at some of your clients, you don't tend to look at them through an emotional veil. You're just looking at the facts of what you can learn from them. And that emotional veil, is that present when you're looking at yourself? Can you notice that?
I can see it in other people.
Okay.
For sure.
Yeah.
See it in yourself.
Well, when they're really worked up about something, and
I think people think that they can hold it really well together.
Okay.
A lot better. But they're probably not as good as holding themselves together as what they think.
Okay.
Because when you look at when people are injured or have these different things going on, the first thing to be able to tell how they're feeling is by how they're actually holding themselves. That's where you posture, tone of voice, all those types of things.
Right.
Someone might be scared to
by
tell
holding
you.
yourself, I think of like more of a social thing. The way you present yourself, but you mean that, and of course just the posture in the chair.
Yeah, I mean, people can definitely trick you, but quite often than not, people are going to come in, and if they're injured or they feel like they're on breaking point, they're going to look like they're on breaking point.
Yeah, okay.
They might think that they're trying to cover it up, but they might have their really nervous posture.
Yeah.
Their voice might be breaking because they're quite nervous about how things are going.
Wow.
They're having these emotional responses to talking about how's training going.
Yeah.
Do you
That's
think
really
you're overdoing
interesting.
it at the moment? If I was to tell you to stop,
The quivering response.
what's your reaction going to be?
Yeah, that's once you tell someone you might have to stop. I think there's a lot to absorb in those next 5 seconds.
Yeah. But people might think that they're like, okay, I'm going to have a really good
It's not a big
response.
deal. It's not a big deal.
Yeah.
It's clearly a big deal.
But I think it's almost the non-verbal things that people do tell you the most about what's actually going on.
Cool. That's interesting. Still keen to hear more about what you're actually doing on the bed, in the chair.
Yeah.
Like, what are you looking for?
So,
What can you feel that other people can't? I mean, there's clearly a degree of expertise that has heightened your awareness to certain feelings in the body, whether it's the tightness or tone that should or shouldn't be in a certain place. What are you feeling? What are you looking for that the rest of us who haven't studied massage therapy just can't see?
I think when you're looking at different muscle textures and tones, texture is probably the main thing you're looking for, because a different type of textures tell you different type of things.
Okay, so by texture, I'm thinking like I have hairy legs. But that's
No.
Is that what you mean?
If you were to look at like a steak,
Okay.
if we go down that level, because
Yep.
basically, I think quite often when you look at humans, you forget that we're an animal as well. And it's a little bit weird to think of, but if you were to look at a steak, it just basically looks quite similar to if you were to look at a cadaver of a human.
Like a nice cross section is what you mean?
It's a cross section. And if you were to look at the different types of steaks or different types of cuts of meat, they each have different textures.
So we need to organise anatomy classes in the supermarket.
Pretty much. But you're looking at like how dense different tissue is.
Okay.
Can you feel any differences between the left and right side? You look at the very superficial, the top layer of your skin, because your skin can tell you a lot of what's
the skin
deeper.
before the fat.
Well, and then there's fascia in between that as well.
And then so the fascia is not just between the muscles. The fascia is also coming out very superficially. Is that what you mean?
If you were to layer it like a cake, you've pretty much got your skin, fascia, adipose tissue, which is your fat.
Yeah.
And then it goes another layer of your fascia, and then it's going to go into your muscle.
Right. Okay. So there's more fascia, and fascia is really interesting. How long ago was fascia not a thing?
I would probably go to say that fascia has always been known about, but not in the way that it's now thought about.
Right. It was always known to be present, but not known to be relevant.
I think people just didn't understand what its role in the body was.
Okay, and what is the role of fascia?
I mean,
see it like a tight net.
It's a forever involving theory of how it influences the body and what it does. I think currently it's probably one of the most researched areas within the musculoskeletal world. Okay,
because there's more to know.
There's a lot more to know. I think people have never really realised how important it actually is.
It's kind of lagging behind. We have certainly a better idea about how muscles and tendons are working. We've been looking at them for a longer period of time historically than we've been looking at fascia. So we kind of expect that. Yeah,
I think if you were to put it how it's changed. Previously, people have been like, the structure of the body is bones. But when you look at the actual structure, if you put two bones end on end, it's going to fall off. So something else has to be able to hold it up.
Okay, yeah.
Muscles can't do that. Muscle is the lever that helps move the bones from place to place. So there's something else that holds it together and helps hold it all up.
Or could you say the muscle would do it as long as parts of it are, active? You've got this like antagonistic muscle action.
What's a pulley force?
Yeah, like a pulley force kind of stabilizing the whole system.
Yeah, and that's where you've got the differences between the antagonist or agonist, or a primary mover versus a secondary mover.
Okay.
But that still wouldn't work as a system without the fascia around it.
Okay.
If you were to look at it under a microscope, it basically looks like a 3D spider's web. And when you look at how strong a spider's web is, when it's almost 2D type of thing, put a 3D into it, it's a really strong structure. Okay.
Absolutely, yeah.
But it's a structure that is heavily influenced by the amount of stress that we put onto it. So if we're dehydrated, it's going to be dehydrated as well. If we're really stressed mentally and emotionally, physically, it's going to tighten up to try to protect itself. So you're looking at the structure that goes throughout the whole body systemically rather than a localized fascia.
Right, and the spiderweb analogy is quite good there because, of course, the spider's hanging out in one corner of its web or in the middle or wherever, and it can feel the whole web.
Yeah.
That's the purpose in having something that's so strong in tension. It's flexible, so you can bend it into all sorts of shapes, but really strong in tension.
Yeah.
So you can feel every little thing that's going on. So if you take that analogy to the human body, then the fascia down in your foot can essentially be tugged the whole way up your leg if you knew exactly what part of the net to pull on. And of course the force will spread and kind of dissipate, but
there's still
we're talking
a pulling
that
force.
level of connectivity.
Well, I think it's an interesting you bring it up in that way. It's quite a common thing that happens these days, and I'm not too sure if I've talked to you about it in this way before, but say with surgery, basically what happens, the body gets opened and it closes down as quickly as possible to void of any infection, which is the right thing to do.
I mean, the body tries to seal itself off
Seals
around
itself
the
up,
wound. Yeah, okay.
which has to happen as quickly as possible.
Yeah.
Which again is the right
Obvious
thing to
evolutionary pressure.
Yes,
Seal
yes,
that guy
exactly.
up. Yeah.
But it's that thing, because it does it so quickly, it pulls everything towards it, which can have pulling forces further away and dissipates further.
Like cutting a piece out of the spider's web and then trying to join it together, you've created more tension where there wasn't tension.
Yeah. And so that's how you can get compensatory patterns happening, moving further along the chain, which might not make sense if you were to kind of ignore that one thing that's happened. So using another analogy is if you were to scrunch up part of your t-shirt, the whole
thing
moves.
just pulls. Yeah.
And it's a similar thing that would happen with surgery or anything where they've gone into the body, even a big enough scar that has a knee stitches, anything like that. So
especially if you're saying that the fascia is right there under the skin as well. But then how does it get below the layers, or are these layers largely independent of one another?
I mean, it's a system.
Yeah.
It's almost, it's kind of should be talked separately as much as it should be talked together with all the other systems.
But how does the fascia transfer tension from one layer to another layer? Does it have connections that go through, or is it via
think of the 3D
tissue?
spider web as well.
Yeah.
So it's a very big 3D spider's web.
Okay. Because I'm just trying to imagine like an off-ramp from the first layer of fascia down into the other layer. Are such structures observable, or is it more that the tension just gets spread through other tissues as well?
More the tension gets spread through other tissues.
Yeah.
So something that I've been exploring a little bit more recently is like the viscera, or your organs, and how they move, and how the fascia around that impacts further along the chain.
Yeah, because what were you saying? Like, the human body is like throwing a bunch of toys on the bed and then throwing a sheet over it.
Well, this is
it's a different point, but I found that hilarious.
This is the point of abdominal tone.
Yeah.
Which is, I think, an ever-increasing issue within the health and fitness sector at the moment, where for a period of time, a little bit changing now, but everyone's been told to lock down their core, always work your core, get it as tight and toned as possible.
Yeah, so maybe they haven't been told to get it as tight as possible, but I think the more I learn about strength and conditioning, the more I realize that people are not trying to separate those two, and by just passively not trying to separate them are actually making people a lot tighter when they're telling them to get stronger.
Yeah.
And you don't have to be tight to be strong. But if you're not doing the release work, or you're making improvements too fast, then you're going to get tight.
Well, I think if you look at it in the way that if you look at height, tone in other areas of the body, that's not your abdomen, people will say it's an issue. But as soon as it's around the abdomen, people are, it's okay, it's what you need. But it's not necessarily the case. The analogy around your organs and your abdomen and having a bed sheet put over it is if you have this weird tone difference from left to right, say along rectus abdominis, you look, well, it's one muscle, how's your different tone onto your left side of your rectus abdominis first, right? I
see. There's a bigger toy on the left side.
Yeah,
right? There's different organs on the left and right side.
That's causing it because it's becoming more fibrotic for whatever reason.
Okay.
And so that type of thing can influence massively this systemic fascia further along the chain.
Right. For example, the kidney it's quite off center, isn't it? It's just on one side, or at least it's a funny shape, and it's largely on two kidneys, one liver, sorry. the liver is a bit of a triangle and it's off to one side.
Yeah.
Then what's on the mirror image part of your torso?
You've got your stomach.
Okay, and that kind of balances that up, and they're going to behave differently.
Yeah.
When you're bouncing around, the fascia is going to form differently around them.
Well, you've got two. Well, if you effectively are trying to counterbalance it, you've got three different organs that have very different roles.
Mm-hmm.
Some of them might be working harder for different reasons. Like if you were to look at your liver, which is basically does everything for you, everything that your body comes into contact with, it has to help filter. But it's also one of those organs that they say has a massive emotional component to it, which again bringing up the emotion, but that can make it fibrotic and not move.
Okay,
and
that's a weird
efficiently as
see,
it could.
My habit was still to go back to thinking about how can the liver be problematic. Well, it must be because of the mechanical bouncing of the running movement, but bringing it back to other kinds of stress that we're not really in the right frame of mind to think about often.
Well, I think again it's really hard to be able to tell what we're putting out into the world versus internally coping with. Yeah. Most often people are trying not to let or give everything away. They only try to put out what people what they will let other people to see.
Yeah. What they're comfortable with other people knowing about.
Exactly.
What suits their image of themselves.
Yeah. But I mean, and then you compare it to the stomach. The stomach is probably again one of those organs that is massively researched at the moment. They're looking at gut flora, they're looking at all this other stuff, which I mean, it's definitely not an area of speciality for myself, but it's important to look at if we look at how they can impact each other. What we put into our stomach is how we fuel ourselves.
Yeah.
And if we're putting all these things into the stomach, that changes the gut flora. If it changes the amount of stress that we're putting onto the stomach itself, if it's overworking or if it's underworking, is it going to be able to get the nutrients out of it that we need to? So if it's working way harder, maybe it's turning it a little bit more fibrotic and not moving. And when you look at the shape of your stomach and the shape of your liver, it fits perfectly into your diaphragm, so it can shut down through your diaphragm.
Yeah, so I'm just like the idea of a stomach becoming fibrotic is just very new to me. Maybe you can send me something later and I'll add to the notes.
Yeah.
On like what that even entails, because as far as I've dissected the sheep and stuff, and you can see the lungs, and they're clearly just pure lung, and we've dissected a muscle, and you can kind of pull the fascia off, and the idea that you can kind of get fascia getting itself in and around other organs. We've got this idea that the body has all these very specialized, mutually exclusive structures. So yeah, still definitely wrapping my head around something new there.
I mean, if
getting into these other organs,
they're very specialized, and they all have their own role. But it's important to think when you look at the digestive system, one can't work without the other.
Yeah.
And so, if your stomach isn't working properly, how can you expect everything else further down the chain? Your food first goes into your stomach.
And how does the stomach actually, how do you say, like manifest that stress?
Yeah.
That whether it's just inflammation markers or this fibrous tone.
Yes.
Possibly all sorts of ways that are yet to be discovered.
So, this visceral manipulation stuff it's crazy interesting, but when I talk about high tone of it, it's the ligaments that are attaching further up onto your diaphragm.
Mm-hmm.
And so
it's all tugging on each other like a big rope tug of war in every direction at the same time.
It's like a pulley system and how things move.
Yeah. Does that explain Stitch? Stitch is a funny one, and I've always just felt like there was someone just tugging a rope on my diaphragm.
Yeah.
Just tugging away. And I definitely noticed that it was always strongly on the right side. After a night of drinking, it would come on stronger, and it was strongly associated with not being fit. So at the start of a training block, I get the stitch, and then as I kind of get some form back, it kind of goes away, and it just felt like something was being pulled apart. Very localized, very strong. That's the image that's always kind of stuck in my head.
The stitches are
Yeah, it's very
interesting
mysterious.
one.
Very mysterious. So much
It's
inconclusive research, eh?
I think it's one of those things that everyone's experienced at some point. I don't think everyone can say it's the stitch is.
Yeah,
like,
what is it, right?
It's different for different people, and some people have been able to figure out for them what's caused it, and some people haven't, because I think there's too many underlying factors that can cause the stitch. I mean, some people it's as simple as eating different food, or eating their food, but it's a timing thing of when they're trying to exercise. Other people, it's scar tissue within the abdomen.
How does one get scar tissue?
Surgeries.
Like surgery.
Abdominal surgery.
Okay. Not just everything bouncing around too much when you're running.
Yeah.
Oh, I always just imagine everything just bouncing around. Yeah, so like that hunch I had with the liver, because the alcohol was one thing that I was very surprised to observe.
Yeah.
And of course, your liver's working quite hard after a big night consuming alcohol.
Yeah.
So perhaps in my case, there's something going on there with the liver being inflamed and pulling on some fascia more. I guess we'll never know, but it's...
Well, that's going to be pulling on
clearly more complex.
One of the ligaments that attaches up into the right side of your diaphragm, which is going to impact your whole right thoracic or your rib cage on the right side.
And you would expect it to be worse if the liver was kind of inflamed or stressed.
Yeah.
Yeah.
Yeah. I mean,
maybe that was it.
I mean, very much so. I mean, that's taken an educated stab in the dark when you're talking about symptoms without actually seeing them right in front of you.
Yeah.
And I mean, that kind of puts you onto the other point of like Dr. Google and Googling your symptoms as well.
Yeah.
It's one of those things that you look at symptoms that you have and the different feedbacks that you're getting from your body, and you Google it, you're going to get the worst case scenario. Always.
Yeah.
Because you're kind of putting every other associated...
like well-observed human biases will always lead us down the same rabbit holes every time.
Yeah.
Yeah, it's really important to have someone who's had the time to aggregate the data and is looking at data that's well filtered and has as little human emotion involved in it.
Yeah.
Another thing I wanted to get into, which I think is associated with the fascia, is needles.
Yeah.
Putting needles through all those layers. Now that you were thinking about cake, and when you're pushing that needle in, I guess sometime in the past I was thinking about the needle going to a certain position down, like the target was a point.
Yeah.
But now I can see that the needle's interacting with everything on the way to that point. It's not just the target trigger point or whatever you're after. It's breaking through or touching multiple layers of fascia on the way through. How do you even know what's going on when you're chucking these needles into people?
So it's important to know with, say, the likes of dried needling, acupuncture, there are a number of
well, if you could also,
I mean, so
in your experience, tease those two apart.
So
I often hear some physios have said acupuncture, and as far as I could tell, what they were doing was dry needling, but maybe not. Or maybe there's just such a crossover now that they've been put under the same umbrella. And I think there is a distinction to be made between modern acupuncture, at least like a relatively Western take on modern acupuncture compared to like the older Chinese acupuncture.
Yes, so that's probably the first place to start, is differentiating between the two. You have Eastern acupuncture, Chinese medicine, that's looking at your system in a very different way than most Westerners would look at it. People are starting to now look more into that as something that has more relevance.
Yeah.
It's been around for 2,000 years.
Yeah.
There's surely some merit into it.
Yeah, I think that's when, like, I used to, when I was younger, get into anything that was pseudoscientific and love ripping it apart. And having seen a lot of the things I ripped apart come into the realm of science, I've had to realize that if I keep doing this, I'm going to be wrong more and more. And often if something's been observed throughout history, there is something to it. Perhaps it's just really hard to figure out and really hard to control and test. But there's something going on in the human body.
Well, I think when you look at research, you have to, okay, so there's an RCT or this very rigorous study that it's really hard to pull apart.
Yeah.
But when you've got that tells you something. But on the other side of it, you need to look at these specialist experts, people that are well trained in these areas, which might not necessarily be able to tell you the exact science of what's going on, but anecdotally, they've done this for a lot of different people and they've seen results. And so you can't diminish the result. It just makes you question what we're using. But so if we go down into Eastern medicine, Chinese medicine, and compare that to Western medicine, Chinese medicine is not something that I fully understand. It's quite difficult to be able to understand it because a lot of it's basically learning another language that I studied in. But it's looking at like energy system, energy meridians and different things like that, and looking at these pressure points, trigger points, that if you're...
Are these the same trigger points?
Different.
No, but you're calling them trigger points. It's distinction probably.
It's kind of the translation.
Okay.
That's... And those...
Right, this is when you see the meridian diagram, they've got the dots the whole way down it. Okay.
And then you compare that to Western medicine. That's something that's been massively researched. And you take the needling approach, you've got kind of, in my opinion, two main differences with, well, there's probably the main one, dry needling, is looking at a trigger point and trying to influence it, and you can create an inflammatory response. Because if you create an inflammatory response, the body goes, oh, I need to heal that. Let's put some effort into healing it.
Okay. So it's kind of like the body's there's a problem there, but for whatever reason, the body isn't being as attentive as you'd like it to be. So you kickstart, you like cause enough of a problem that it passes some activation energy and the body pays attention.
Yes, I mean, you look at the body and there's a hierarchy of needs that it takes care of. And I'm under the opinion that the musculoskeletal system is quite low on that hierarchy of needs.
Right.
A lot lower than...
That's an interesting way to think about it.
A lot lower than as a practitioner or as a runner you think it is.
Right, And psychosocial stress is probably the thing that is always underestimated.
But then you compare the musculoskeletal system comparative to the digestive system, comparative to the neural system, the lymphatic system. These are life support systems.
Okay.
And so when your body has to heal itself, if all these other systems are a little bit out of whack, your musculoskeletal system is not going to have a lot of input and energy put towards it.
That's a really interesting thought, thinking about that hierarchy of needs. I suspect that we will uncover more and more about this in the next 10 years as there's more research going into the way people use their time every day and the way they use their attention every day, and we'll begin to understand what's causing all these chronic conditions. Well, there's obviously clear things causing them, but I'm sure there's things that are making them worse, and a lot of these things are just going to contribute to the correction of a number of problems all at once.
I think if you put it under example of the worst case scenario, like a really bad accident that somebody has, where they've got multiple systems that are impacted, whiplash, for example, they've got like their neural system is going to be completely out of whack. It takes a long time for that to heal.
Like the deceleration of their skull.
Different things like that. You've got potentially other organ damage, quite often the spleen from the seatbelt. Different things like that, which, I mean, they're really important, that the body has to take the time for those to find a new equilibrium. Homeostasis is kind of the word that, and the medical word that you use, is trying to find balance again. It might be a different point of balance than before the injury, but then again, like these injuries, you've got a continuum of what it needs to heal, and the musculoskeletal system is going to take the longest to heal itself in the way that your body might not function in the same way as it did before. And because it's going to be trying to protect itself as well. I mean, that's quite a big another topic, and we've kind of digressed from dry needling.
Yeah.
For sure.
Why are you sticking needles so deep?
So the way that I look at dry needling is looking at tissue that have been structurally overloaded over a longer period of time. So,
and is there a distinction between the repetition of a lower load exercise? Well, I guess running isn't always the good example of a lower load. Depends what muscle you're looking at in particular. But like cycling, for example, where the peak force is relatively low compared to a weightlifting sport where you're pushing the peak force that muscle can do. Is there a difference in the way your body responds to those, or it's all just the accumulation of the stress?
It's more the accumulation, and it's kind of looking at, I mean, you kind of compared right there a very short, intense sport to a long endurance sport, which of lower intensity. Both of those, if you were to put them on a curve, there's going to be some crossover where you look at the intensity versus duration, there'll be some crossover, and so the body's going to look at the stress and look at the load and respond accordingly. The tissue is going to respond the same, relatively the same, and so from a dry needling perspective, you're looking at changing however that responds or presents itself. Okay,
what's actually going on if you were to zoom in a microscope with that needle? Like, I've heard some theories that there were certain hormones, or maybe even, was it serotonin or something, was potentially being released at the site of the needle. I mean, I can't remember what
I think
substance it was.
There are a lot of theories,
a lot of hypotheses, and
a lot.
Science is still sifting through the rubble.
And so the first one I think is important to look at is creating an inflammatory response to heal itself. The one that I've done some study and I kind of have found works well with the patient population that I work with is trying to look at the afferent and efferent pathways sent from the brain. And so that's basically changing the perception of, or changing the brain's thought process about these tissues. So it's quite a bit different. So if you're looking at
if there is a problem there, you don't want the brain to ignore the problem. Or is that only working for cases when the problem is largely neurological?
I think the neurological aspect is probably the good point to look at. Because the nervous system is the thing, or the nerves is what creates these muscles to fire and respond.
Right, it's working. So the nervous system is the detection and the activation system.
So this is, if I was to push onto your calf,
suffers, and it's the
well, if I was to push onto your calf, your body knows before you know that there's a
you
signal
respond
there,
very differently,
and so you're going to respond in a way that's safe. And so this is kind of on the same premise as that, is that if you've got a very small needle going into it, your body's going to pick up that there's a sensation there. It's not going to see it as a threat, and eventually it's going to relax.
Wow.
Just to chuck that one into the mix.
I mean, it's very strange the way, I mean, it's such a small needle that it's not really doing that much damage. So what is the inflammatory response to? Is it to the small amount of damage, or is it just kickstarts a larger inflammatory cascade?
So the way that I do it is not trying to create an inflammatory response.
You're trying to reconnect. You're trying to deliver awareness and let your body handle
diminish
the rest.
the signals getting sent to the brain.
Okay, so I see what you're saying. If it's the neurological system that's causing the overactivation, and then you go back one step, it's causing the activation because it's receiving a signal, and then you try to diminish the signal that's going to the brain, then the brain also reduces the activity of the muscle.
Yeah. So it's a circular thing.
Circular logic kind of going round.
It goes around
You've
in
got to
circles.
intervene at some point in the cycle.
And again, it's one of those really hard places to research, because when you
I don't know how you isolate that from all the other stuff going on.
Exactly. And it's really difficult because when you look at an individual, every individual is going to respond differently. And so if I had two people come in and they had the exact same injury, they're going to feel it differently, going back to how you feel pain differently.
Yeah.
But the response that they get is going to be different as well. And you can't do a control for it either, because how do you do a control when the intervention is sticking a needle into somebody?
Fake needle. Get them to close your eyes. You numb the spot. Perhaps you can.
But
if you numb it, then you're interfering with the nervous system as well.
But that's one of the, when you're looking at a randomized control trial.
What is the control?
Really rigorous
what is the alternative
research? Quite often you've got these controls or placebos that are used to help prove or disprove theories, ideas, hypotheses. So I'm kind of saying that it doesn't work, but anecdotally, from all the population I've seen, and I think most people would put it out there, that they've found that it works. So or to some degree, they've had some form of change.
Yeah.
Because you're always looking for change. You're not looking to fix someone, you're looking for a change.
Undoubtedly. I've experienced just increased range of motion instantly. I've seen a muscle just totally relax, like lose its tone.
Yeah.
And I mean, that's otherwise inexplicable. Like I've, hobbled in and walked smoothly out from needling and also from massage as well. Same with myofascial release as well. Like, what's your take on that? And is that essentially what you're doing with some of your massage stuff? And how is the different? You've talked about sometimes the difference between compressing the muscle and compressing the fascia, comparing that to pulling the muscle and fascia apart. Are they working on it through different mechanisms?
Again, it's kind of, there's a lot of questions in there, to be fair. Yeah. And it's always looking at the individual and looking at how they're presenting in front of you, because it can change from week to week, depending on what they've done that week.
Yeah.
So it is a big topic, but if you put it in a way of, I quite like using the analogy of using glad wrap as an example.
Yeah.
And if you look at glad wrap, what you can do is you can push on it and you can stretch it. If you go too hard too quickly, you can break it. If you don't press hard enough, it's not really going to do anything to it.
Okay, yeah.
So that's
it'll just bounce back, and you can break it if you go too far. Yeah.
Yeah, and so that's a visual for what I'm trying to do. But then again,
I think most people with their rollers at home, the idea is to endure maximum suffering.
Yeah, foam rolling is
people want to feel a good response.
Foam, and we were talking about earlier this week, foam rolling is something that me personally, I question people's use of.
Yeah, you said there's a time and a place, but
for everything,
a lot of us, that is almost all of our massage, our maintenance, almost all of it for a lot of people is just compression of the muscles and the fascia with a roller.
Well, I think a lot of research has started to be done within the last couple of years about a foam roll and what it does, and coincide with fascia and how that works as well. Obviously a foam roller compresses, and that compresses the fascia. But what we're questioning now is, how do we decompress the tissue? Does the tissue need to be decompressed?
Well, what is decompressed tissue? That's not like toned.
No, so it's creating more space for everything to slide and glide in between each other.
Okay, so if you squash two different muscles together, they tend to stick a bit together? Or is this, pushing into the realms of the unknown?
Look at it in the way of, so if you look at your thigh as a good example, so you've got your four quadricep muscles, you've got your iliotibial band, which is connected just below the knee and up towards your hip, your hamstring group, and your adductors. Quite often, people really go to town on the iliotibial band, ITB.
Oh, yeah. Good release. Like, it's definitely a sensation of release the whole way down.
But is it the ITB the issue? Because the ITB should be tight to a point.
Yeah, how tight?
To a point.
You got to set your scale right, and I think most people's used to very tight Achilles scales.
But because
shifted a bit.
You look at the ITB being tight, if you're looking at it for what all these structures, muscular structures in the fascia does around the knee, it's trying to stabilize the knee. The iliotibial band helps stabilize the lateral or the outside part of the knee, because there's not the structural integrity from the bony structure of your femur.
Yeah, right. If they all work together in team effort to do the job.
But the tightness from the ITB is not caused from the part on the thigh, in my opinion. It's caused from the muscles attaching it.
Yeah, so we're talking TFL.
Glute
TFL,
max.
man.
Yeah, exactly.
Invented that shit.
And then you're looking at it being kind of fascially stuck to vastus lateralis, your lateral quad, the outside quad. And so my question is, if you're going too hard on your ITB, you're going to get symptom change, but you're fixing the issue.
Okay.
That's
right.
That's my question to everyone.
Yeah, and I guess my anecdote with that is the trick to release my ITB didn't involve the ITB. It involved the TFL. Yeah. Yeah. All I needed to do was get some dude to stick an elbow in that sucker. And after drooling on the pillow for some time, it just let go.
Yeah. And that's going to change the tone along your ITB.
Yeah, that's right. Okay.
But if you take that a step further, how did your TFL get tight in the first place?
Yeah. Too much of a certain exercise that I wasn't strong enough to do. So I was...
So biomechanical overloading.
Yeah, I was just ramping it up, too motivated.
Other hip flexors not working in the right pattern. There's multiple factors of why it can come on.
Yep.
And so if you're treating someone for a iliotibial band syndrome, lateral knee pain, patellofemoral, anything that has quotation, ITB, presentation or effect of it, is foam rolling the right thing to do to that specific structure.
So you're not going to say it's the wrong thing if it helps reduce the pain, but it might not be the complete picture.
Might not be the complete picture,
Yeah. Because there's definitely instant release, obviously, from doing, or instant relief, I should say.
Yeah.
You feel the mobility without the pain.
Yeah.
And notice that with pretty much every muscle in my body and I've assumed that was largely the purpose of massage, was doing what a roller is doing, pushing, and your body seems to let go.
Yeah, I think the difference
what would you add to that?
Foam rolling and massage, there are a number of different effects that differentiate the two between it. One of the big ones is, and to be honest, don't exactly know, but anecdotally, you look at skin-to-skin contact. Skin-to-skin contact is first experienced in someone's life when they're first born with their mother.
Yeah.
So we're going to go way back.
Yeah.
It is one of the things that we don't necessarily notice that we do, but we do anyway when people are stressed. When people are sick, and you can kind of hear it
for millions of years.
You can hear it when you're around these really stressful situations when you just look like you need a hug.
What's with that?
Your feel-good hormones, your serotonin, things like that.
Yeah.
Your stress hormones diminish automatically when you receive a hug. It's skin-to-skin contact and a sense of belonging.
Yeah.
And so when you've got this very isolated foam roller, or you've got this thing that you're getting hormonal changes, having the ability to talk to someone if you want to.
Yeah, there's more.
So message-wise, I think
I've got a good relationship with my roller. I don't know what you're saying, but that feels like skin-to-skin contact.
Yeah, but it's those things that you might feel like it does, but it's not the same.
Yeah, absolutely.
And I mean, as I said, I think foam rolling has a time and has a place, but I don't necessarily think it's your be all and end all all the time. And I think that's also important to note that you can do it wrong. And you can do it right, you can do it wrong.
Okay, what is wrong? Too hard? Too often?
I
Just
think
the wrong spot?
all of the above.
Okay, it's all possible. I
above.
haven't seen it. I guess is it relatively benign doing it wrong? Or have you seen people cause problems from being too keen on the roller?
Yeah.
Oh, okay.
Yeah.
Okay.
And this is what we're talking about before, kind of the less is more versus more is more.
Yeah. So what is, I guess, there's not going to be one size fits all. Some muscles, you're going to feel a lot of pain when you roll them because that's where they're at. But you shouldn't always be pushing to feel that level of pain as the feedback for doing it right.
Well, I think if you were to talk to most people about why they don't foam roll, their first response will be because it hurts too much.
Oh, yeah. 100%.
100%, right?
Yeah.
Without a doubt.
Everyone says that.
And so when that's their response, that I call into question of, is it the right tool all the time? As if for most people it's too painful. So I think
they're not ready yet?
That's the point, yep.
Okay.
Yep. That's one thing.
Okay, because at least my experience is the sooner I get through that pain, the sooner I feel better.
Yeah.
And maybe I'm treading a thin line there. I don't know.
I think,
good.
Like most things, less is more. It's a very cliche saying, but it becomes a cliche for a reason.
Yeah, okay.
And you're better to do less of something if you're not completely sure what effect it has, how to use it, rather than jump. I mean, you yourself is a little bit different in this. If you're looking at it like a amateur runner who's just bought their first foam roller versus someone who uses it all the time, they kind of know what they're going to get out of it.
Kind of putting the power of a massage therapist in your own hands.
Yeah, and you're kind of looking.
What if one of your clients directed your massage, told you where to push? Okay,
a lot try to, but this is where one of those things where you get a foam roller and you get a pamphlet of what you should do.
Right.
And
at least a starter's kit.
It's a starter's kit.
Yeah.
But if you look at if we go runs, but you look at how everyone moves biomechanically, there's a massive amount of variation between that. So how can you say that everyone should do it the same way?
Yeah.
And so that again,
I don't know if people are saying that, but no one's saying anything.
Well,
just like use a roller.
They're saying use a roller. It's the thing to do. But what I think is important to look at is how often we do it.
Yeah.
How long for. And I think it's important to be shown how to use it as well, because there is, as I said, there's the right and the wrong way, but also looking at the connection points of if you do one thing somewhere, how is it going to influence everything further down the chain feels? But also, if I'm getting pain or sensation in some place, is pushing on it harder going to make it better or the worse?
So these other modes
in the short term or the long term, because you might get short term relief, but long term, is it beneficial? Because I think that's the thing, that looking at it of whether or not it's a good recovery tool. Short term, yes, potentially. Long term, I don't think we can say definitively.
We just don't know. Yeah,
you might be able to say if they're going to do a research study over 20 years looking at someone's fascial health along the ITB.
I'm up for it. I'm already on 8 years of continuous foam rolling action, so let's see.
But they didn't. But you'd have to do a cross section, like you'd have to take a biopsy before and after you start.
Stabbing me with those big things. Those are huge, man.
Don't sign me up for that one, please.
Wow.
That looks
like the student job where you need
$1
grand to do essentially a danger job no one else wants to do. Yeah, so
all for the point of research.
Yeah, so like what we're doing with the foam rollers, we're essentially just squashing things. But there's also this technique of skin fold massaging where you're trying to put a translational tension between the layers and kind of pulling them sideways? Is that what you're trying to do with the skin fold, or is it more pulling the layers apart?
If you think skin fold or skin rolling, that's where you bring decompression into it.
So you're pulling the layers
you're
like
kind of
apart,
pulling
like the layers of the cake
apart.
are separating.
Yeah.
Is there a technique where you're like frictioning, where you're
so you're looking at
translate the layers?
If fascia has gotten tight or stuck to itself with the structures around it, trying to torsion it to help release it, because everything it will have its full range of movement, and then you'll kind of have what's called R1 and R2, resistance 1 and resistance 2.
Yeah. What are these?
So resistance 1 is kind of looking at that very first point of tension. The patient itself might not feel it, but the therapist
you're
can.
feeling it. Okay.
Yep.
So that explains when sometimes the physio or the massage therapist will lift your leg up and move it, but not to the end of the range of motion. And I'm thinking, well,
I can go.
They just can't be bothered.
Yeah, no.
So they've picked up something, and it's not that stretch feeling that you're familiar with if you try to do a stretch.
Yeah.
They're just looking for a lower level of resistance.
They're looking at the first point that your body that your body compensates to the movement, which is the important thing, rather than the full range.
Okay.
In my opinion.
Okay. Yeah. Oh, I'm sure there's more there to tease apart.
If you were to look at when you, if we look at a situation of someone getting lower back pain that's driven from hip flexors that are too tight, which is a really common issue that a lot of runners have. If you've got an R1, resistance 1 of 30 degrees of extension before your pelvis loses pelvic control.
Yeah.
But you're hyperflexible through your joints.
Right.
And so you've got
static stretch, you look good.
Yeah.
Oh, okay. Well, that throws my routine on its head. My maintenance routine's all about
I was going to challenge you on
the static stretching. Okay.
And so this is, you're wanting to change R1 because when you run, as soon as your leg gets 30 degrees behind you, your pelvis goes into an anterior tilt.
Yep.
But if you were to statically stretch, this person might have 90 degrees, 120 degrees of full range before they feel a stretch.
Okay, and that's because your body has detected that you have achieved that range of motion and it's trying to pull it back.
Yeah.
Okay, so it's an active thing. Is that a good way to talk about, like an active response compared to that structural?
Well, it's looking at
response?
A passive movement, but comparing it to how someone can see in an active movement how it can impact them.
Okay, it's a better way to say it.
Yeah.
And so, that's interesting.
And so when someone's doing, it's important to be honest, it's important to look at both, but you're more likely to, the less your resistance 1 is, the more likely you're going to injure yourself. Your range of movement might not be as much because you might be able to get all this movement, but your body doesn't want to.
Right. If you looked at a really good gymnast, would their kind of R1 and R2 both be large but be very close together?
I imagine that. No, to be honest, I haven't worked with too many gymnasts before. Stab in the dark, they've got two very different resistance 1 versus resistance 2.
Oh, it's different.
Yeah.
Okay.
So,
because I was imagining like they have control through a large range of motion.
Not as much as what you'd think.
Oh, yeah.
Yeah. To be honest,
people on the pummel horse are doing the splits on that little thing. Like, is that how you define control? The ability to activate on your own accord the whole way through the range of motion, or are we dealing with control as more like an accuracy thing?
I think when you look at a gymnast, to be honest, I've worked with gymnasts that are retired and about 40 to 50 years old.
Not the prime specimens we see on
not
TV.
People that are between the ages of 10 and 25, which you're an elite gymnast when you're 16. You can be an elite gymnast when you're 16. And the women, they're considered old if they pass 20.
Yeah.
Men probably more into their early 20s, mid to late 20s is when they peak. If you were to compare, they're very flexible, hypermobile to a point, very strong.
Yeah.
So they've got these hypermobile joints, but they've also got a lot of strength.
Okay.
So the strength is making up for these hypermobile joints. As soon as
But the R1 is more about control, is that what you're saying?
It's the amount of movement they can get before they compensate.
Okay, right. But they're so strong that they just push through any kind of compensation that their body's trying to invoke on their conscious movement.
I think gymnastics is a sport that is amazing. Like, it's ridiculous. I love watching it.
Yeah, I know. It's like such respect because I just cannot comprehend it.
It looks so much easier than what it actually is.
Oh, it even looks easier. Because it looks terrifying.
Like, I'd love for you to just do a forward roll and see how much it hurts.
Yeah.
But I think it's an interesting thing to look at when you're looking at flexibility, mobility, rigidity, strength, all these different things. They've got it from a young age, but they don't have it going on, and that's where people need to watch out for. But yeah, going back to R1 and R2, R1 is something that most often people stretch through R1. They're going to go to R2 because they want to feel like they're doing something. Yeah,
well, that's like the only feedback I'm familiar with. This is a totally new concept, actually.
But I think that's an important point where quite often we get told to stretch.
Yeah.
But how do you know how to do it?
And how much is your stretching towards the R2 limit helping you? Is that increasing the R1 at all?
Often not.
Often, yeah. That'd be interesting. There's more there to learn. That's a totally new concept. How have I missed that?
It's one of those things that, put in the way of, you only know what you know is because you've been told it.
Yeah.
Or you've read it, or you've heard it somewhere. And so with a lot of runners, I think everyone, myself included, is notorious in this, is we do it because other people do it.
Yeah.
And you look at elites because they do it. And this is something that clinically is forever evolving.
Seems to be working for him.
Yeah, it seems to be working for him, but I think it's, as an athlete, you need to be really challenged.
Yeah.
Because how can, like, you look at these elites and you're like, they do it this way. But, I mean, for me, I'm not an elite. I'm kind of far from it, to be fair.
Yeah.
Other people might beg to differ, but how could I expect me to respond the same way as this prime specimen who's putting literally everything as their job into their body performing as well?
Yeah.
I kind of think that there's this big gap between these amateur, younger athletes trying to become elite athletes. I kind of think they're looking at the wrong things, personally.
You mean working harder as opposed to working smarter?
Yeah. Yep.
Okay.
I think in New Zealand they were notorious for working harder.
Yeah. Well, certainly that's my story.
Yeah.
Is burning out twice.
It's my story
last
as well.
year, being like, I can sleep when I'm dead.
Yeah.
And obviously that was just a funny joke, haha, until I was burned out.
Yeah.
And then it felt like a silly joke.
Yeah.
I just thought it wouldn't really creep up on me. There were still triathletes getting up at 5 a.m.
Well, I think
that's still not me. So if they survive, I'm fine.
Like, surely I'll be okay as well, right?
Yeah, I'll be okay. And I guess I just have a different combination of stresses, and it all kind of fell apart in a way that was unexpected, somehow unexpected.
Yeah.
Even though it seems totally obvious, it's somehow unexpected.
Yeah. I think that's important to know, like, especially as your younger generation is coming through, trying to become a professional athlete from a young age, which I think in this day and age is very fair, as like people are just, the technology is evolving and everything. But I think people need to learn to work smarter. Like, our body is a system and we need to treat it well, because it's quite often one of those things that you might be able to get away with training a certain way for 10 years, but if you would think of doing something wrong for 10 to 15 years, your athletic career is as a peak specimen.
That's a waste of a lot of time.
But it's going to be really, if you're in most sports, becoming an elite sports person, trying to go to the Olympics, from the age of 14, chuck 10, 15 years on that, that period is past. So it's really important for a young athlete to kind of, in my opinion, get it right.
Yeah.
And that's where, again, less is more. Doing the right exercise.
Yeah,
and
getting the right therapy.
Yeah.
not necessarily the most satisfying therapy. Because like those rollers just feel so satisfying. They just feel like they must be doing something good.
Well, I think that's where you've got the difference
Stretching feels
between good pain
Yeah.
and bad pain. Because there's a difference.
Well, yeah, and it's just homogenized, really. It's
Well,
like,
because if you were to look at, say, foam rolling is a good example, training is another good example, there's kind of that good pain when you're like, you know what, that feels like it's making a difference. And to be fair, it probably is. But there's a point, and it's a very, very fine line, that it can very quickly feel from good pain to bad pain, or good training to bad training.
Yeah.
And it can be as fine as 10 to 15 seconds extra on the foam roller, going a little bit too hard for a little bit too long.
Yeah.
It can be doing that one extra 1K rep that went from a really good session that pushed the boundary just as much, versus you did that 1K rep at all of them perfectly, like the times were perfect that you wanted them to be, but the last one was 30 seconds slower.
Yeah.
Like, that's the boundary of good training versus doing too much.
Yeah.
Because that's kind of burning. That's where those things around burning yourself out are, or pushing too hard too soon.
Yeah. Well, I think that's quite a good place to leave it. I felt like I asked more questions than
you probably have more questions. You have more questions, I imagine.
Definitely a lot more with the needling. I'd be keen to get into another time.
Yeah.
It's still quite mysterious how Eastern and Western have quite different philosophies around this, and I suspect that it's not all one-sided. And I'm sure there's a lot more mysteries to tease apart there with the other manipulation and other stuff that you do as well.
I'd love you to
more
get
to
a
learn.
Chinese medicine guy to come in, or girl to come and talk about it.
That would be really enlightening, actually.
Because, I mean, for me, I'm trained in Western medicine.
Yeah, you're honed into one
and I look at it in a very holistic manner.
Yeah.
But with a Western perspective, looking at holistic practice from a Eastern Chinese perspective.
Yeah.
Would be awesome.
It'd be really interesting.
Yeah.
Yeah. All right. Thank you, Luke.
Thank you.